Next slide. Yes, we used mail questionnaires, which was 20 pages, and if necessary, additional phone interviews. We also assessed the whole working life and different exposures, such as pesticides, solvents, smoking habits, etc. And these questionnaires were sent about 2 months after diagnosis of cases. So we had histopathological confirmation of each case, and they were reported to us from the cancer registries in Sweden. Regarding cellular telephones, we assessed first year of use or time period, type of telephone. It is possible by the prefix. So all analog phones in Sweden started by 010 and the GSM phones by 0.7. Average number of calls per day, minutes per day, use of an external antenna in a car. And that time was disregarded as exposure. In fact, we had a number of cases controls that had always used external antenna in a car during phone calls, and in that subgroup there was no increased risk of brain tumors. Use of hands-free, which was very uncommon, was anyhow disregarded as exposure. And of course, ear most frequently used or equal was assessed. We also this time had exposure to cordless telephones, same method used, and we assessed anatomical localization by medical records, X-rays, etc., computer tomography, and also histopathology was assessed. Now to the results, and I will jump into them because these have been published previously. As to the gliomas or astrocytomas, there were 663 cases, and as you can see, this gives results, overall results for all cases and controls, ipsilateral exposure and contralateral exposure. And for mobile phones, we see that the highest risk for ipsilateral exposure, which is a doubled risk, which is significant, increasing to 3.3 using 10-year latency period. So this fits with what one would expect, both of area for highest exposure as well as latency period. The same pattern that was found for cordless phones had the highest risk for ipsilateral exposure, 5.0, which was significant. And for the contralateral exposure, there was no significant increased risk. We made, next page, we made a change or a separation of exposure into 1 to 1,000 hours, up to 2,000 and more than 2,000 hours. Regarding mobile phones, you can see that the highest risk was for those with more than 2,000 hours of use, 3.5, and there was a significant trend. The same was found for cordless phones, with the risk increasing with number of hours of use. And then we can get on to the acoustic neuronomas, which were 243 in total. In the next slide, we can see the results. First, we have overall for mobile phones the risk 1.7, increasing to 2.9 for 10-year latency period. And again, the highest risk for ipsilateral exposure, which goes from 1.8 overall to 3.0 for more than 10-year latency period. Similarly, for cordless phones, we have the highest risk for 10-year latency and ipsilateral exposure. But as you can see, there was only 3 cases and 15 controls in that group, so it was based on rather few low numbers. Next, that's number 10. We separate hours of use 1 to 1,000, and again up to 2,000, more than 2,000. And we can see that the risk is highest for more than 2,000 hours use, which is mobile phones 3.2, significant result, and for cordless 2.1. And again, increasing risk with increasing number of use. The trend was not significant, however. Is that okay? You can hear me?
Yes, yes.
Okay. Hello. Regarding meningioma, the next number 11, we have overall no consistent pattern of an association, although for both phones and cordless phones, we find the highest risk for ipsilateral exposure and 10-year latency. But these results are not clear as for acoustic melanoma and glioma. Number 12 shows again that the risk is highest with more than 2,000 hours, but it's significant for meningioma. Now we are number 13, which is the interesting results for age groups. And we have here separated those who started the use before 20 years of age, those who started the use 20 to 49 years, and those who started in the age group 50 to 80 years. And for overall case controls, we find the highest risk for those who started before the 20 years old, which is 5.2 as an odds ratio, based on 15 cases and 14 controls. So they are not that many, but it's significant anyhow. And this risk increases to 7.8 for ipsilateral exposure. Contralateral exposure gives no significantly increased risk. But of course, when one divides this, it's based on rather few subjects. Going to the other age groups, find again the risk to be significantly increased for ipsilateral exposure, but much lower than those who started before 20 years of age. One could of course think that this is a phenomenon of latency, that those who started before 20 years of age have used for much long time the mobile phone, those started later on. But we have looked into the time from first use of a mobile phone until tumor diagnosis, and there is no significant difference in these groups. So this result seems to indicate that those who have started in younger age are more sensitive to microwaves from mobile phones than those who started later. Number 14, we have for cordless phones, and again we see the same pattern, that the astrocytoma risk is highest for those who started before 20 years of age. The risk is 4.4, going up 7.9, almost 8 times increased risk for ipsilateral exposure. So these results are, of course, again, with the mobile phone, finding very troublesome and worrying regarding young persons' use of mobile phones. Number 450, the next please. We have looked into acoustic melanoma and mobile phone use, and we can see the same pattern, that those who started before 20 years of age had a 5 times increased risk, going to 6.8 for ipsilateral exposure and 2.4 for contralateral. But you can see that this is based on extremely low numbers, so we must of course be cautious when one interprets this. The risk is lower for those who started the use later age. Number 16 is acoustic melanoma and cordless phones. And unfortunately, as to statistics, there was only one case that started before 20 years of age, so it's difficult to interpret anything from these results regarding cordless phones and acoustic melanoma. Next, please, is number 17. And here you can see a graph which shows the odds ratio in different age groups. Those who started under 20 years of age, 20 to 29, 30 to 39, 40 to 49, 50 to 59, and 60 to 80 years. And the brown is mobile phone and the blue is cordless phone. And just as a look, one can see that the highest risk is much higher in the young age group. And we can also see on the bars the significance or the confidence limit, which is a significant finding in the youngest age groups of an increased risk. Next, please, is number 18. We can see the same for acoustic melanoma and mobile phone use, with high risk in the young age group. But again, we can see that there is not much about cordless phones in the young group, so this is the blue one, but there was only one case in that group. Number 19, we calculated the attributable fraction. How many of the cases could be explained by use of a mobile phone? And Regarding astrocytoma, the attributable fraction was 5.2%, which would explain 32 of 613 cases. And for cordless phone, it was over 1.6%, 10 cases.